Ladies and gentlemen, please welcome Robert McCray, co-founder and CEO of the Wireless Life Sciences Alliance.
Good morning. It's great to be here and great to see you all here. New friends, old friends, colleagues from early years. I hope everyone made it into San Diego okay. I'm sorry about the weather. It's not very good out there. I want you to think that it's really not good until the breaks, and then you can step outside, okay, for those of you who came from colder climes. We really appreciate the time and effort it takes to come. We have people from India, from China, from Europe, from all across the United States and Canada, and I think Latin America, and all coming to join us, to join your peers, and we welcome you. Now, a couple of housekeeping items. One is in your books, you have an insert, the new agenda. This is the correct agenda. The one that's bound up has been changed in some important ways. I'll say for speakers that you will be mic'd and prepped outside, so stage left outside the room, first hallway through the black curtain, and you'll find the team that will mic you up and get you ready to go. So I've prepared some remarks this year. I'm often just act as the convener because I really think that the value of the community and of the meeting lies in all of you finding each other and figuring out who you can do business with, who you can create products with. But I think we're at a time of transition in wireless and connected health. And I've been thinking about it a long time, been talking about it more, proselytizing a little bit, trying to expand the community beyond what it is today. So I'm going to, if you'll bear with me, share some thoughts about that as we set up the rest of the day. As you know, we represent a very broad community of healthcare, technology, and consumer business sectors, and the research and funding communities. We offer 2 annual meetings. The Convergence Summit is our oldest. We started in 2006. And it's intended to foster from day one the development of useful connected health products and services, while the wireless health research conferences, which we started in 2010, are intended to foster the integration and cross-disciplinary activities of the health research and STEM research communities, because we need both working together in order to develop the potential of this sector. These are some of our affiliates that are involved, especially in the Wireless Health Research Conference series. Of course, in a meeting like this, we also depend on our members, on our admission fees and sponsors, and some of our key sponsors, financial and supporting in media, are depicted here. So I think in a world of digital communications, analog relationships become even more important. We've maintained the size of this meeting because we wanted to bring together the most committed people and organizations in wireless and connected health. So over the next 2 days, we'll have 60 individuals on this stage. And collectively, the discussions and presentations will represent the full range of connected health. 150 different organizations are represented among the approximately 300 attendees who are registered for this conference. And I hope you'll pay attention to the presentations, but you will draw energy from the private conversations with your fellow participants. So we do allow and provide substantial networking time. And I'll be disappointed if you don't walk away with 10 or 15 or 20 business cards that are worth meaningful follow-up after the conference, along with a pocket full of new ideas. So our motivation for this meeting and for the WLSA itself was to create a new technology-enabled business sector that will be more financially valuable and more valuable to society than any that has preceded it. I think that's the potential that we have. In the creation of these sectors, and I think of the internet itself, or digital music, internet commerce, a relatively small number of people and companies do the work. They do the shaping of it. They feed from the collaboration that occurs when they meet with peers, and that, again, is what we do here. And that's our goal, to provide the forum on an ongoing basis here in San Diego and then throughout the year for those peer-to-peer relationships that will create this sector. So I'm going to spend a few minutes to talk about how far we've come in the 8 years since this organization was created, and where I think we are going and where the dialogue has to change. I think we have to expand our thinking. I think we have to think about the problems that we're trying to address in new ways, or else we may not meet the expectations that have been set for this sector. And they are big. I mean, we're being counted on to save the economy of the United States and save the lives of tens of millions of people who are on their way to living longer, sicker lives. Technology is no longer the limiting factor. I think technology is progressing far more rapidly than the markets are. The pathway to success requires that we break down some of the institutional headwinds that defend the status quo, often from well-meaning people. And it requires that we bend or change the demand curve for healthcare services. I think we have to accomplish both of those. Traditional healthcare approaches, even enhanced by the technologies that are being created and implemented, cannot keep up with the demand of an aging and increasingly chronically sick population. We can't innovate fast enough to do that. I think we have to do more and think differently and get new players involved. In short, I think we need the full participation of the consumer sectors, the food, electronics, and entertainment sectors, in order to reduce the number of non-compliant patients and to expand the number of engaged consumers who are living in a society that values and supports healthy behaviors. People must understand the limits of medicine. It can't fix everything. And people must come to value the personal empowerment that arises from a healthy life. Success in this sort will actually free up more resources to focus on the diseases and injuries that are unavoidable and accidental. We can't get away from those, but we need more resources there. So I think there's a different triple aim from that which has been talked about so much. And I think the triple aim is better health, lower cost, and more productivity, more societal productivity that's freed up by better health. So in 1999, Don Jones, my colleague, friend, partner, and I began to look for ways that we could improve healthcare services where we'd both spent our careers with the application of digital wireless communications. And as you know, Qualcomm supported this work. A few years later, hired Don, and our collaboration continued. We looked at numerous ideas in this space, a wide range of chronic and acute health care and health and wellness applications. And we had careers in healthcare services, so we understood the inefficiencies of disconnected health and the quality issues with disconnected health. And I'd say then as now, payers and consumers were faced with critical sustainability and access challenges. And those really remain and are continuing. So our healthcare expenditures per capita, the US at the top of the heap, of course, rising faster than GDP. Rising out-of-pocket costs for consumers, $1,000 per capita in the US now. Despite all this spending, compared with other industrialized nations, the U.S. does not have the best outcomes. It has the worst among 20 countries. There has been an inverse relationship between the amount of Medicare spending at the state level and outcomes at the state level. That gets your attention, I think. Let me back up, and we'll stop there. So we're spending a lot of money, and we're not doing well. And that's, maybe everybody knows that, but it's worth repeating. And because that was part of the motivating factor for us starting this organization, and it continues to say to this day. And we had the basic notion of bringing together the experts from healthcare and technology, and then subsequently the consumer sector, to overcome the lack of knowledge, the uncertainty. I mean, tech companies looked at healthcare back then and said, you know, that's a really regulated, special area of the economy. We don't understand it. We shouldn't get in. And of course, you had to overcome the ignorance. In the early days, going around to venture capital firms with a company, you'd have to try to get together the healthcare expert, the life sciences expert, and then the IT expert, and to talk about a wireless health convergence in a play. And they just weren't used to dealing with each other. We wanted to create more converged experts. My colleague and board member, Jeff Belk, could tell you a story about sort of a who's on first conversation he had with a healthcare guru, a futurist, back in the early years, and who was so confused because Jeff was talking about radios in wireless health devices, and the futurist, the healthcare futurist, saying, "What does this have to do with he's thinking of broadcast radio. What's that got to do with wireless health?" You know? So we're beyond that point, obviously, but it's been a journey. You know, we had discussions in the early years, you know, what can healthcare learn from Hollywood? And that was patient engagement. And can phones prevent infections, which was about crowdsourcing and big data and analytics? Can wireless silicon replace your doctor, which is machine learning? The ultimate CRM tool, which is, of course, the personal phone. And we had lots of early innovators. We're seeing them go on. Some of them have become big names. Others have had successful companies, acquisitions. We used to talk a lot about what could be done with convergence. 8 years later, we have tens of thousands of mobile health apps. We have more than 100 wireless medical devices that have been approved by the FDA and are under in commerce, and more coming weekly. Hundreds of millions of dollars invested in the sector. You know, multiple competing adjectives, conferences, blogs, thought leaders, businesses describing opportunities in the space. Lots of converged experts. So I'd say the convergence has occurred. So, you know, I'll give you some examples of the changes, and this is out of order, so I'll jump here. Well, so much for that. I presented a slide back then, which I don't think I have in this deck, of what I call telemedicine 2.0. It's a stick figure with surrounded by devices, wearable, worn in the environment, connected to the cloud, to coaching, to physicians. Last month, Samsung, announcing its S4, came out with a program called S4 Health. And it shows their phone surrounded by a cloud of health and wellness apps and medical device apps. So, you know, that's real. We have Sotera Wireless, cuffless, wearable blood pressure and vital signs monitoring in the market today. We have connected diabetes management with TelCare. We have all natural, at-home fertility services for patients that qualify for in vitro fertilization with no yuck factor and dual fertility. We have an affordable ECG in your pocket in AliveCore. We have primary diagnosis coming in your pocket with Scanadu, and even more diagnosis with the Tricorder X Prize. So, companies and investors have begun to realize, or are realizing, or have realized that this is the biggest addressable market in the world. We have more than 6 billion people accessible to digital images, digital communications. We have linked mobile operators and platforms that make it relatively easy to reach all of those people. So you have distribution. We have a universal human need for healthcare at some time in our lives. And unlike cultural services, and other content, genetically and biologically, human beings are virtually identical. Blood glucose measurement, blood pressure measurement are the same for human beings, all around the world. So there's no other addressable market like connected health, and it is a global market. So are we done? I'd say not yet. While technology, I don't think, is a limiting factor anymore, confusion is, because institutions and consumers now have a hard time sorting through this noisy world of digital and wireless and electronic and mobile and and connected health to find what is going to be good for them. And customers don't buy if they're not certain about the value. They have to feel that there's a value. That slide just changed and I didn't do anything, so what happened? Does this mean that we're on my back on my deck? This is the stick figure. I'm going to back up and see if that's to happen. Maybe not. So there's this confusion. We have to overcome the confusion. And another impediment now is our regulatory systems and our policy approaches to healthcare are based on 19th century models and 16th century trade models in terms of the professions. And for a lot of well-meaning reasons, we have barriers to innovation and barriers to change, barriers against competition that are all been built up over a century and more. We need to change the dialogue in policy discussions in order to accelerate the process of knocking down some of those barriers. And we need to focus more on the unmet needs for public health than we have been doing. It isn't all just about health care. We also need, and I think all of us who've been in healthcare for a long time recognize this, and those of you coming in should, that we have to recognize, we have to avoid the mistake that has plagued healthcare in the past. In most sectors, technology has made products and services cheaper and better over time. And in healthcare, they've made services better, by and large, but also more expensive, farther, more out of reach of the people that need them. So what are the trends of concern? And I've got some data that's on the slide here somewhere, but I'm not going to go try to find it. Study produced a few months ago, academic study, of baby boomers basically reached the conclusion that baby boomers may live longer than their parents. That's still a close call. But they're definitely going to be sicker. So I'd say sicker and longer lives, that's not what we want as people. At the same time, extensions in life expectancy have been kind of the penultimate claim for the industrial world and even to some extent for healthcare. That's what we're doing when people are living longer. But here in the United States, there was another study just recently produced that showed that certain demographics in the United States, richest country in the world, actually are showing declining life expectancies. And they weren't minority populations, unless you consider poorly educated whites, male and female, to be a minority education. So we're not getting the job done the way we are. And I think maybe everyone recognizes that, but it's worth emphasizing, and we do have some non-healthcare people here. So we have a system that is inefficient, it's opaque, it faces structural failure if we don't do something differently. And it's already, abandoned tens of millions of citizens, and we want to address that. And that's the opportunity, and there's a business opportunity to address that. If you go back to that slide on average spending, there's a market opportunity that's global that is bigger than the entire US spending on healthcare, and that's just if China and India themselves come up to the world average spending on healthcare. Because I don't know if you notice, they're down there around $300 or $400 per capita. The world average is $1,000, the US is $8,000. Just bring China and India up to $1,000, the world average over time, and you've created another few $1 trillion in healthcare spending. And here in the United States, bringing the affordable services that do that to healthcare means that you can serve those 50 million people that aren't being served today and make money at it. So I don't think healthcare is going to be the first industry to disrupt and shrink itself, but I think connected healthcare, what you're creating, is moving in the right direction. And I don't know, these slides are bouncing around, so I'm not sure why. All right. I think we may be back to the right deck here. So technology is already enabling transparency in the healthcare system, and Todd Park's Open Government Initiative is one of the things that's encouraging that, as it unveils more information about hospital charges and outcomes. The tools for more effective and cheaper diagnostic services and treatment of disease are being built, and they're becoming affordable. Knowledge of better, cheaper, and more consumer-friendly approaches to health care drives decision-making. And it will disrupt, and it is beginning to disrupt traditional healthcare, just as it has disrupted publishing and music and retail and other industries. I look at this estimate the Institutes of Medicine published on waste in healthcare, $750 billion per year in the United States, and think there's hundreds of billions of dollars of business opportunity. And this is sort of the traditional digital technology disruption of a sector. So I think that is starting to happen. We want to make it go faster. But the consumer kind of movement that I envision will actually improve the climate and support it. It'll increase the awareness of the opportunity to improve the healthcare system and eliminate some of that waste and the suffering that goes with it. But the second problem is chronic disease, and that's a different issue. It's an even larger opportunity, though. So, estimates are 50% of healthcare spending is driven by chronic disease caused by lifestyle and behavioral choices. Some people say 70%. That seems a little high, but 50%, let's just use that number. So if half of healthcare spending is driven by lifestyle behavior, then theoretically that's an addressable market. There's an addressable opportunity there. It offers huge rewards, and it also delivers productivity. If you can accomplish any part of that, it delivers productivity to the society, to the employers that those people work for. Now, a lot of healthcare people are skeptical about tackling this because we have seen so many failures in health and wellness and prevention. We know that compliance or non-compliance is a huge issue for healthcare. Lots of waste there, and there's lots of opportunity there. So I think this is where you have to have a thinking shift. We have to go beyond healthcare. We have to think of health. We have to think of what consumers want. And if we're going to change consumer behavior in a fundamental way, we have to change their expectations. We have to really change the culture. And I think there are good examples for doing this. This is the decline in smoking, about a 50% decline in smoking in the United States over a 3-decade period. This reduced lung cancer rates by maybe an estimated 40%. because not all lung cancer is caused by smoking. And there were taxes, and there were place of use regulations, of course, on smoking starting in the 80s. But in addition, at least here in California and New York, we used some of the money from the early cigarette taxes to run campaigns. And they were effective ad campaigns that sold the dangers. They made smoking ugly. Having the Marlboro man, who was an icon of the 50s and 60s cowboy culture, talking through a hole in his throat because he'd lost part of his throat to lung cancer, was sort of a turnoff for people. But even more important, Hollywood, producers, writers, actors, took up this cause. And they started not putting smoking in their scripts. They started not smoking themselves, at least in public. They changed the culture because they are cultural leaders. And I'd say that smoking is not cool. Maybe there's a few people that sneak out here for a cigarette. I'll tell you that 25 years ago, I went to the American Lung Association, American Thoracic Society joint meeting, and none of the Lung Association attendees smoked. But an awful lot of those doctors did. Well, they don't do that anymore. So we changed, the culture changed, and that, I think, brought down smoking rates more than any other single factor. Another example I like to use is the automobile industry. So in the 70s here in the US, it was on top of the world, but it was capital intensive. It's highly regulated, it's dependent on government investment. But at that time, it was the products were inefficient, they were expensive, they were not safe. And 40 years later, and I've got a Prius next to my college car there, they're cheaper, they're more fuel efficient, they're safer, they're more comfortable, they're more fun to drive. There's no question which one of those cars you would buy today. They cost the same amount of money. And we've done that in that industry. And part of the reason they're safer is because of regulation, setting expectations, because of technology. But a lot of it is because there are two behavioral factors that we've embraced. 75% of people, when they get in the car, they put on their seatbelt. And it was 0% in the 50s because the cars didn't have seatbelts. And in the 70s, even into the 80s, it was socially acceptable to drink and drive. And I'd say because of Mothers Against Drunk Driving, it is not socially acceptable anymore, except in small parts of the community that are troubled. So these were behavioral changes that affected real outcomes. They reduced the demand for healthcare as well at the same time, although that's not why they did it. A final example is just energy as a percentage of GDP. Our gross domestic product is growing, and energy conversations in the 70s were about nuclear, whether we should use nuclear power, did it make sense, was it safe, coal, oil, import more oil, et cetera, et cetera. But a movement occurred that said, well, let's look at the economics of this and let's look at what we really want. What we want is productivity. So the conversation was shifted from how do you produce power, burn coal or split atoms and so forth, to how do we get the productivity more efficiently? So the conservation and the clean tech industries were created. And I think that is, in some respects, none of these are perfect, but that's pretty close to a perfect metaphor for the difference between a focus on health, which is what people want, what we want as people, and health care, which is what we need when we don't have the health that we want. And I think that if we start to think about this and think about that problem and get the players, that part of the society and the industry that are used to creating and meeting the demands and desires of consumers, that we can actually tackle these behavioral issues that have been so vexing for the healthcare sector. So, in short, I'd say in the connected health community, the connected healthcare community, we don't want to get hung up on the adjectives because all those are features or enabling technologies. We want to focus on the end result. This is what people want. This is what we're all about. and it's a lifestyle and a cultural change. That is a very, very large market. And I think to some extent, there are examples out there. The vitamin supplement business, in some respects, is an example of this. People using discretionary spending to buy products that they think make them feel better, and maybe they do. There's a lot of scientific evidence for it. These are brands that are upselling products based on, I think, an engaged consumer attitude that this makes them or their families better. It makes their life better. And it's being better, it's being sexier, it's being taller, it's being more successful. That's why people buy things. And the consumer sector, entertainment sector, can associate all kinds of things with those values. Healthcare can't do that by itself. So in this market, the food industry will associate its products with nutrition in the same fashion that, and power producers will sell, they do sell conservation now. The retail industry will create campaigns that compete for the loyalty of these consumers, and some companies are already doing that. Concepts of a healthy environment for a population facing aging and chronic disease will be incorporated in government research, in regulation, and in planning. Industry will create the tools that empower personal health, and this is all going on. I mean, you think about it, there are examples of all of these things. I think people will embrace health. I think they're starting to think that health is cool, and they'll find out that, you know, I can't make up ad jingles, but healthy people have more fun. You know, remember the blondes have more fun? Well, healthy people do. And there's an area of personal responsibility. So if we empower that, if we engage it, if we make it cool, we as consumers will buy those products. So I think everybody in this room can play a role, is playing a role in creating this future. I think the full business potential of connected health care will only occur if we also foster the creation of this consumer movement. And because that will drive the demand for the products, the services, and the changes in regulation that allow consumers access to them and allow employers to bring them to their beneficiaries. So to that end, you know, we are reaching out. We want to expand this community even broader, bring more of the consumer and entertainment sector involved, the dedicated people and companies. And I hope that you will enjoy and join us and help us. So thank you for your attention.